Hello everyone, I am Onco Nutritionist Sanjana here. Today I shall be speaking on the topic nutritional care process, and we will also be understanding the unraveling framework and understanding the critical components that guide decision making in various settings. The nutritional care process includes four major steps, which is nutritional screening, nutritional assessment, nutritional diagnosis, and monitoring and evaluation. Let us go deep inside in understanding what each of these steps includes. The first one is the nutritional screening. Nutritional screening is extremely important as it helps us to understand the patients who are at a risk of malnutrition and providing them with the early intervention. Various studies have been done which have concluded that early nutritional intervention has shown to have a positive impact on the health, and it also helps in reducing the hospital stay as well, and it will also help in providing the right nutritional care for the patient. The nutritional screening can be carried out in any setting. It could be either a hospital or it could be a clinic or even at a school as well. So hence it is very important to do the nutritional screening of an individual. And based on this, we can take the corrective action as to what can be done. Nowadays, there are various screening tools which are available. It could be the nutritional risk tool, which is the NRS, or it could also be the subjective global assessment, which can be carried out. The next step of the nutritional care process is the nutritional assessment. In nutritional assessment, we generally do it in the ABCD approach, wherein A stands for anthropometric measurements. Here we take the height of the patient. We also note down the weight, and how much of weight loss has occurred in a patient, and also we understand what is their current body mass index and how much should be their ideal body weight. Next is B, which is for biochemical parameters. It is extremely important in understanding the biochemical parameters, which will also give us a better understanding as to how we need to curate the diet chart for a patient. The important biochemical parameters which we need to look for, especially for cancer patients, is the hemoglobin levels, the absolute neutrophil count, the platelet count, renal function test, lipid profile, and also the liver function test as well. Next is C. Now C stands for clinical signs and symptoms. So now when a patient is going to be coming to you, they will be having certain signs and symptoms, which is very important for us also to understand. So these signs and symptoms could be anything like loss of appetite or pedal edema, hair loss, and also it could be certain signs which we see in them, like they have an enlarged belly. So these are some of the signs and symptoms which is very important to look out for in a patient who is going to come to us, and we need to make a note of it. D stands for dietary intervention. Whenever a patient is going to come to us, it is extremely important to note down that 24-hour dietary recall, because it is important to understand what the patient has been eating, how much is the quantity of the food of the consumption as well. And we also need to understand if they're having any food allergies or food intolerance towards any food. We also would like to get an understanding of their food frequency. For example, what is the frequency of consumption of cereals, or what is the frequency of consumption of milk and milk products in their diet as well. Now, for this ABCD approach, there has been one more addition, the last one, which is E. E is called as evaluation. As a nutritionist, I have given a diet chart to the patient and I have also understood what are their major concerns. However, it is also important to understand if the patient is able to adhere to the diet or not, and also what are the challenges which they have been facing. Now, the next part of the nutrition care process, what we go on to see is what we call as the nutritional diagnosis. Now, why is nutritional diagnosis important? So now you have got an understanding and a detailed information from the nutritional assessment as to what is the patient's concerns, what are the signs and symptoms which they have been experiencing. So now it is important to understand the purpose and also to identify the presence of a nutritional diagnosis. So this is going to help us to describe the a specific problem and how to tackle this problem as well. So over here what we look at is, for example, a patient is going to come to you. They are going to say that I'm going to be having a loss of appetite, or I'm having a loss of sense of sensation. So this is a nutritional diagnosis based on which it is going to help us to understand how we need to plan the diet chart. And the last one is the monitoring and the evaluation, or else what we say as the nutritional intervention as well. Now, nutritional intervention are the actions which are taken to treat the nutritional problems and by resolving the causes or by reducing the related symptoms or the signs. So over here what we have done is we are going to ensure that we are also going to help in reducing the symptoms or the signs which the patient is facing by giving them a detailed dietary guidance. Now, if a patient is going to come to us with gut health related issues, this is a main nutritional diagnosis, because what we need to do here is that we need to ensure to reduce this symptom or sign. So, based on the nutritional intervention which we are going to give for the patient, we are going to do a frequent follow up in understanding how the patient is adhering to this. So this is the nutritional care process, how it comprises of. In conclusion, the nutritional care process is a dynamic framework that empowers the nutritionist to deliver an enhanced care. Following these steps is just not a protocol, it is a pathway to guide the patients towards improved well-being. As a nutritionist, incorporating the nutritional care process ensures a comprehensive and a personalized approach, ultimately leading to the better outcomes for the cancer patient.